Hello Peter, my name is Philip with RuleTract. As you may already know, I want to go over a couple of quick setup points for the OR in-service, and then I'll address your questions regarding how this differs from the adult retractor. First of all, when you're going to put this clamp on the table, and I know this was covered in detail in my long setup video, just want to go over it again. When you put this clamp on the table, try to reach in between this area to see where the bolts are, and then put the clamp in between the bolts or directly over a bolt. Most important, when you put the clamp on, squeeze the jaws closed onto that rail and keep squeezing them onto the rail, and then turn the knob to tighten it. Don't use the knob to bring the jaws together on the rail. You will not get a good purchase on the rail, as you already know from, this is the same equipment actually that Zimmer uses for pectus, minus the resternotomy attachment. So you're going to go ahead and put that on the rail, squeeze it tight, tighten it as tight as you possibly can. Now when you put the post on, and again I'm sorry if this is a repeat of what Zimmer does, but just want to point this out to be sure, because not all Zimmer people are aware of it. When you put this post into the clamp, you have to make sure that the bend is going toward the patient's head. If it's going this way, it's not going to be easy to set up. So it's designed actually to go toward the patient's head to give the assistant room to work here. So you go ahead and put that into place, tighten it down. Obviously you know how the top post goes on across the chest, straight across the table. Now something that is a little bit different, actually the same piece that Zimmer has also. When you have a smaller patient on the table, you want to bring the retractor closer to the patient. The way to do that is to put this extender bar on inverted with a knob on the bottom. So if you put it on like this, obviously you're going to bring the retractor closer to the patient. Very often you're going to have a small patient for these resternotomies. In the congenital heart population, very often you're going to have small patients. Excuse me. And other times you're going to have very large adult patients. And if you do, you're going to want to put the rotating extender bar on like this. Now it's a little bit out of my camera shot here, but it raises it up 2.5 inches, so it allows you to have additional space over the large patients. Inverted brings it closer to the smaller patients. For the purpose of the video, we'll just put it on like this. Make sure that your lock knob is going into one of the detents here to position this correctly so it locks onto the top post. Go ahead and tighten that knob, and then you're going to put your retractor on. Same thing, make sure that there's a pin that comes down through here that has to go into the detent that's on the top of this extender bar. I've seen this go on every way that you can possibly imagine. There's only one right way to do it. So you put it on here, line it up between the alignment marks, and tighten it into position. And when you bring the retractor down toward the patient, it's important to bring the retractor down. Don't use the handle to unwind it. That's where a lot of people get in trouble with the RuleTract. The cable starts to get kinked. If you do things the way that they're supposed to be done, they will work correctly. So we'll go ahead and flip the reversing lever, which again is covered in detail. Lower the retractor to the incision. You would take your resternotomy retractor, prior to lowering it, hook it onto the snap clip, lower it. This is a subxiphoid incision, which is covered in the procedure video as well as the article. So what they do here is they'll put it in subxiphoid, elevate, and then start the incision to reopen the sternum for reoperation. How does that differ from the adult? Well, in the adult, we're using it only for IMA. Well, I can't say only, primarily for IMA. So in that situation, you would have this rake plate. Your top post geometry would be different. You don't have the extender bar because you don't need to extend out over the center of the chest. So you would just attach this rake plate to the snap clip, and then you're going to elevate one side of the chest only for the IMA procedure. So as you can see, this actually wouldn't work at all because we're midline here. We don't want to be. So for the purpose of this video, I'll stop here. That's how it differs Well, I can't stop because I feel like I didn't do my job. So let me take this off. All right, so the top post geometry is going to be a little bit different. I don't have one with me. Did you get the idea? These are really sharp. Be careful with them. Go ahead and put this on to the top post. Lock it into position, and then you would be able to put this into the sternum and elevate it for the IMA procedure. So those are that is the difference between the pediatric resternotomy retractors and how they are used and what they're used for, and the adult rule track rake plate. Sorry for that quick video. I hope it helped. Call me if you need to, obviously, and we can go over any of this. Thank you guys so much for doing this. Okay, good luck. Have a good day.